I'm Manpreet, the Paediatric Diabetes Specialist Nurse here at the Hillingdon Hospital. Today we're here at the Annual Review Clinic. The purpose of the Annual Review Clinic is to ensure that patients receive all the necessary checks recommended nationally for young people living with diabetes. This allows each member of the team to spend time with the patient to see how they're getting on. The clinic is coordinated by a paediatric diabetes specialist nurse like me, who ensures that you complete all the necessary procedures. So you see the nurse, doctor, dietitian and the clinical psychologist. When you arrive in clinic, your height and weight is measured by the healthcare assistant. This helps us to make sure that your growth is satisfactory for your age. All patients over 12 also have their blood pressure checked and are asked to provide a urine sample. The phlebotomist will do your blood test to screen for other autoimmune conditions such as thyroid and celiac.
My name's Varun, I'm 16. I was diagnosed with type 1 diabetes last November. At the start of the annual review clinic, I was a bit nervous and I thought it'd be quite painful when they said they were going to be checking my feet.
I'm going to do a foot check. We do this to make sure that there are no signs of any complications. I will also look at the injection sites, so I'll have a feel, make sure there's no lumps and make sure they're using enough of the sites. It's really important to look for lumps because lumps can really affect how insulin is absorbed in the body. So if someone has a lot of lumps, the insulin can be absorbed really erratically and can affect their blood glucose control. I'm going to do a HbA1c test. A HbA1c is a measure of blood glucose control in the last 3 months, and this is done using a small finger prick sample of their blood. All patients over 12 should be a part of the diabetic retinopathy screening programme. I will ask them, have they been referred, have they been attending appointments?
We'll talk about your diet, we'll talk about the things that you're eating, and we'll look at any opportunities to make your diet a little bit healthier. Is that okay with you?
Yeah, that's perfect. The next time I won't be as worried because it didn't hurt at all. It was a nice environment.
My name is Farula. I'm 11 years old. I was diagnosed with type 1 diabetes when I was 3 years old.
And how has everything been in terms of managing the diabetes?
I think it's been pretty good.
Yeah.
I would say lately she's been saying she just feels nervous or anxious for no apparent reason.
Yeah. Is there anything specifically you're worried about?
Because it says there's 8 units. Is the maximum, so we make sure it doesn't go over that.
Basically what we're having to do is say, oh well, you can't have that, you can have this. Or
So have you seen this before? So your reds are your highs, or 7s and above. Yeah. The blues or purples are your hypos, and then the greens are within normal range. Sort of, I think 2 o'clock in the morning you were there, you were high. We'll change the settings around to, and that's to allow for more insulin. And actually you're right, because you've also had a growth spurt. Yeah. And while you are growing, you will need more insulin. If you've got your handset, you can make the change now. Do you know how to do that? That's brilliant.
So Farula, I think we've met before. My name's Leah and I'm the clinical psychologist with the diabetes team. And as part of the annual review clinic, what we like to do is just to check in with everybody at least once a year to hear how you're getting on and how you're coping living with diabetes. Diabetes affects all aspects of your life, and it can just sometimes just add a little bit more stress to stuff that's already there, and you know, we want you to be able to sort of carry on as normal as possible. So in any way that we can sort of support you with coping, or family relationships or other relationships. I'm around till you're about 19, okay? When you'll move on to the adult service at that point, but that's not for a long time yet. So you've kind of stuck with me.
I used to be kind of scared of the doctors. I used to get really nervous around them. Like, I'd get wobbly legs and everything. But I feel they try to make it really comfortable and homey.